Good afternoon, everyone. Thank you so much for joining us today. My name is Aisha Azam, and I'm the Vice President of Medical Affairs at the Patient Access Network Foundation. I'm pleased to join you this afternoon to discuss the Extra Help Low-Income Subsidy Program. Before we begin, I would like to provide you with a few housekeeping notes. Throughout this webinar, if you have any questions, please use the questions section within the chat box to submit your questions. We will answer them at the end of this webinar. We know many of you have also sent in questions before the webinar when you signed up. Please be assured that we've received them. They are great questions, and what we're going to do is answer those at the end as well. We're going to provide you with a lot of information today. So for your convenience and your reference, this webinar will be recorded and available on our website. We'll send out an email notification to you when it becomes available. Lastly, our contact information will be provided at the end of this presentation for any additional questions you may have. You can always refer to resources available on our website at panfoundation.org. Now, let's go ahead and get started. The PAN Foundation is an independent, national 501c3 organization dedicated to helping federally and commercially insured people living with serious illnesses with the out-of-pocket costs for their prescribed medications. Since 2004, we have provided nearly 1 million underinsured patients with $4 billion in financial assistance. Partnering with generous donors, healthcare providers, and pharmacies, we provide the underinsured population access to the healthcare treatments they need to best manage their conditions and focus on improving their quality of life. Learn more about PAN at panfoundation.org. Let's meet today's speakers. We're joined by Casey Shores from the Medicare Rights Center and Clara Lambert from Tailman. Casey joined the Medicare Rights Center in 2011 as Client Services Counsel. Today, she focuses on education and federal policy, helping deliver accessible and accurate education materials to Medicare beneficiaries and the professionals who serve them. Casey regularly gives presentations on current developments in Medicare. She also advances the policy goals of the Medicare Rights Center through the administrative rulemaking process and supports Medicare Rights' close working relationship with legislators and their staff. Clara is the Director of Financial Navigation at Tailman. Prior to this role, she worked as a financial navigator for 7 years in hospital systems in Michigan and Illinois. Clara has a background in insurance verification, financial counseling, and many other aspects of the healthcare revenue cycle. She has always been involved in implementing technology, process improvement, and team building activities wherever she works. As she believes highly in efficiency and building new talent through mentorship. Financial toxicity is an important topic to Clara, and she has been able to use her personal experiences along with her background in healthcare to connect with the patients and caregivers to streamline the financial navigation process for everyone. Clara and Casey today are going to walk us through defining the extra help benefit and explaining how we can apply for assistance. We'll go over common misconceptions and share resources to support you and your patients. And at the end, we'll leave time for questions to answer any that were submitted to us before and during the webinar. So let's begin. What is Extra Help? Extra Help is a valuable program that can lower a patient's out-of-pocket medication and premium costs by 85% or more. But many people don't know that they qualify or they struggle to navigate the complex applications. For economically vulnerable Medicare beneficiaries and people with disabilities, the Low-Income Subsidy program is a critical safety net that helps cover out-of-pocket costs for prescription drugs. By shielding low-income seniors from high out-of-pocket prescription drug costs, the Low-Income Subsidy is designed to facilitate access to needed treatments. There's extensive evidence showing that the LIS program has been successful in achieving this goal. One study of Medicare beneficiaries showed that the out-of-pocket cost to fill the first prescription of a new cancer medication was $3 for LIS beneficiaries and $3,000 for non-LIS patients. Beneficiaries in the LIS program will more likely to start the new program and less likely to have interruptions in care. Clara and Casey, thanks so much for joining us today. And why don't we begin by understanding what the Extra Help program is? Casey, would you like to start?
Sure. Thanks so much for having us. And thank you everyone for joining to learn more about this program. So Extra Help is known by a couple of different names. It can also be known by LIS, or the Low-Income Subsidy. And it's a federal program that's administered by the Social Security Administration, which is, or can be a little confusing for folks because it's a program that works with Medicare, and Medicare is run or operated by the Centers for Medicare and Medicaid Services, or CMS. So you might be wondering, or people might wonder, why do you apply to Social Security for this program that works with Medicare? And that's because Social Security and CMS work together to administer the Medicare benefit, and Social Security handles some of the financial aspects of the program, including the LIS, or Extra Help program. It pays deductibles, premiums, copays, and coinsurance for people with Part D plans. So these are people who are eligible for Medicare, enrolled in either Part A or Part B, and have a Part D plan. It also provides a special enrollment period for people who are entitled to the Medicare program but not yet enrolled in Part D. We'll go into some of the details of these in future slides, but that's sort of the big overview.
That's excellent. And that's such an important distinction that you made between the Social Security Administration and Medicare. It's often, often it seems as if people refer to Extra Help as a Medicare savings program. Is it a Medicare savings program?
It's not a Medicare savings program because the Medicare savings programs are specific, different programs. It is a program that helps people with Medicare save money. So I think if you were just sort of looking at those words as they are commonly used in sort of everyday English, I can see why someone would say this is a Medicare savings program, but the Medicare savings program label, or that title, is actually given to different assistance programs that work with the other parts of Medicare. Those programs pay for Part B, as in boy, premiums, and can pay for Part A and Part B cost sharing.
Got it. That's so helpful to know. Thank you. Clara, let's dive into the application process. What do we need to know?
Yeah, so the application. Sure. So the application process is can be considered complicated, but it's, I guess maybe because I've done it multiple times, I don't think it's super complicated. It's fairly straightforward. Extra Help has, or PAN Foundation has put together a checklist of documents to get together before you do the application, and it's pretty good. If you have your Social Security card, your Medicare card, your tax returns, anything to do with your income and your assets, and then go to the Social Security Extra Help application website. The applications are done online, and anybody can do this application, not just the person who needs to apply for Extra Help. So somebody who's advocating for the patient, or a son or daughter or brother or sister can do this for them.
Oh, that's great to know. If someone's ready to apply, and they gather information, where should they go to the SSA website? Should they go to CMS's website? Where's the best place to go?
Yeah, so it should be the SSA website. And one thing that I forgot to say is that there are actually some people who are automatically enrolled into the Extra Help program. And these people are people who have Medicaid, or who already enrolled into the Medicare savings programs that Casey talked about on the last slide.
That's great to know. Thank you. Casey, what would you say is important for people to know about the application process as they're getting started, before we jump into eligibility requirements?
Sure. I think what Clara said about it not feeling particularly complicated because she's done it a few times, a lot of times, is also, it's also true that it's, whether or not it seems complicated to you, I think probably depends a bit on what other programs you have applied for or what other application processes you've helped people through. I would say the Extra Help application is massively more simple than, for example, a Medicaid application. And one of the key differences there is that the Extra Help application is an attestation based application. So you need the information that's in these records that the checklist on the right-hand side of your screen is showing, but you don't need to submit those records as part of the application. This isn't a situation where you need to prove up your assets like a Medicaid application where you would need sort of documentation from a bank confirming the assets that you have. You just need to know what those numbers are and you can enter them into the application. That I think is something that a lot of people sort of, the sense that you will have to submit all of this proof and documentation can be a barrier to applications, and having to do that can be a barrier to applications for other programs like Medicaid or the Medicare savings programs. And that's a real benefit of the Extra Help application process, is that you, your personal attestation, your promise that the information you're providing is correct is sufficient. You don't need to prove up the information with documentation.
Wow, that's really good to know. So we have this checklist, right? We have a list of everything we need and we gather it together. How do we identify who's eligible? And are people automatically enrolled? Like, when are people automatically enrolled, when they're not? Casey, do you want to start?
Sure. So this is what Clara was mentioning. There are certain people who should have this benefit that we don't need to spend time helping get the benefit because they should be automatically enrolled and probably already have it. And those people are those who have another type of health insurance or health insurance benefit, people with Medicaid or the Medicare savings programs. There are a few ways of sort of finding that out. One is to, if you know a person's income, so if a person's income is less than 100% of federal poverty level, they probably already have Medicaid or the most generous Medicare savings program, because these benefits are more widely known. There are fewer people who are eligible for Medicaid and not enrolled. And so people who have Medicaid get Extra Help automatically. You don't need to apply for them. Some other folks whose income is higher, so we'll talk about the full eligibility guidelines, but for folks on the higher end of that, though they might be eligible for a Medicare savings program that could also help them, we know that those programs are really under enrolled, as is Extra Help. And so lots of people with incomes in that 100, 135, 150% of federal poverty level don't know that there are programs available to help them. They're less likely to be enrolled in Medicaid already, and so less likely to be automatically enrolled in Extra Help. The other way to find out if someone already has the program, so you don't need to go down the path of helping them apply, is to ask about how much they pay for their prescriptions when they go to the pharmacy. We'll talk a little later about how the program reduces prescription co-pays, and because the program puts everyone's copays to a set amount. If a person is paying the same amount for all of their prescriptions, and that same amount is one of the dollar amounts that's listed in the chart, and we'll go into, there can be different numbers based on the person's exact level of extra help, but if they're paying those dollar amounts for their prescriptions, then that's a good indication that they already have the program.
Okay, that's a great point. Ask people, look at people's copays, and if they're high, if they're not around the extra help level numbers, the benefit numbers, that's a great way to identify someone who might be eligible or might find value in getting this benefit. Clara, you began telling us about, how to apply and the application checklist. Walk us through that a little bit more so we understand exactly how to do it.
Sure. So I think one of the very first steps is just to make sure that that you're within the income and asset levels before you start that application, because I think everybody's time is valuable. And make sure that they have Medicare A and B. And if they have Part D, that's fine. If they don't yet, that's all right. And then the materials that you need. The application is done online at ssa.gov. And when they do that application, since they haven't been automatically enrolled, they can cross that application over and apply for the Medicare Savings Program. And then once they're approved, because hopefully you've done your screening well, then it is important to take advantage of that open enrollment and select a Part D plan.
That's great to know. And I love what you said about screening. There's a ton of screeners online on Social Security Administration's website. The PAN Foundation has a screener eligibility wizard on our website, where you can actually enter in the patient's state, the residence, their assets, their income values, and be able to see whether or not this patient may be eligible. So there's a ton of tools out there to even get the process started to help you identify those patients too.
Yeah, and even before starting the application, you're screened.
That's a great point. What are the specific eligibility levels? Casey, you began alluding to that and talking about, what those income and asset levels are. Tell us more about that and what qualifies as assets.
Sure. So the basic income and asset limits are on your screen. You can see that the limits are different for people who are individual or filed jointly as a married couple. There's a slight asterisk that we should put here. I think for folks who are married but file separately, I'm going to have to do a little bit of digging because I'm not sure that it is exactly the individual amount. I think that married filing separately still uses the joint tax filer amounts, but I will double check that. So assets are generally things that it's mostly cash in the bank, right? It's stocks and bonds and other resources like that. Your primary residence does not count as an asset. There are certain other things that are excluded from the calculation of the asset limit, including burial funds. These are pretty detailed. So especially if you are working with someone whose income or assets are close to these limits, you'll want to either do a little bit of research or reach out, and we'll talk about the resources that are available, but reach out to someone like Clara or myself and get a little help, because the way assets are counted is a little different. Actually, the way income is counted is a little different than you might at first assume. There are types of income that are counted differently. For example, earned income is counted differently than income from Social Security. So it's always worth a second look if you think someone is pretty close to the income or asset limit and just on the other side of qualifying for the benefit.
Oh, okay. That's a lot of terminology, and I feel like as we get even deeper, you know, we those two levels of extra help coverage, those partial and those full extra help. Tell us more about that, Casey, and what are the differences?
Sure. The differences are just based on income and assets. They're not, the differences aren't based on anything else. So if you qualify for full extra help, then you get the benefits in that column. And if you qualify for partial extra help, meaning your income and assets are a little bit higher, don't meet the qualifications for full extra help, then you are in the second hand side. So for full extra help, the extra help program reduces your premium to zero in benchmark plans. Now, benchmark plans are plans that cost an amount that is set, or lower, an amount that is set within each state based on the average cost of a non-enhanced plan, meaning a plan that covers the most basic benefit in Part D in your area. And that amount is published annually by CMS. So the amount, what the dollar amount is for a benchmark plan in each state. It's in the Medicare and You handbook, and it's also on Medicare.gov. And also, if you look at the cost of plans in your area, you can probably figure it out pretty quickly, because there's going to be a lot of plans that are right at that level or pretty close to it. The thing to know, so in partial extra help, your premium is reduced on a sliding scale based on your income. The thing to know about full extra help is that people in full extra help can choose plans that cost more than the benchmark amount if that plan suits them better, but they are responsible for the difference in the premium. So it's not that you are not eligible or not allowed to enroll in those plans, and it's not even that the program will not work for you. Instead, the extra help program will pay the amount of the benchmark, and then you'll pay the amount over that. In some states, there are other programs, and we'll talk about this, that can work with extra help and reduce that cost even further. But that really varies from state to state. Full extra help reduces the deductible, which is the amount you must pay before your plan starts paying for prescription drugs, to zero. Partial extra help, the deductible is $92 or the plan's deductible, whichever is lower. So if the plan's deductible for everyone, anyone who enrolls in the plan is $50, then your deductible with partial extra help would be $50. Excuse me. Full extra help and partial extra help eliminate the coverage gap, which means there's no change in the amount that you pay after you reach a certain out-of-pocket, a certain total drug cost. This is less of an issue now than it was in the past, because the coverage gap has been reduced or eliminated for everyone. This is where we can identify a little bit more if people have the program. And this is usually what I ask when I talk to someone: how much do you pay for prescription drugs when you go to the pharmacy? If the person says, I pay $4 for all of my prescriptions, then I know that either they have extra help or they go to Walmart and don't use Part D. So they say, I pay $4. I said, do you really pay $4? There's about $4. Do you have a receipt? And then you can look at it. The $130 and $0 are the amounts that people who have full, who have full Medicaid and people who are at an institutionalized level of care. So those are further reductions in Part D costs for people who have other benefits. The copay for brand names is $9.20, $4 for people who have full Medicaid, and $0 for people who have an institutionalized level of care. Once you have an out-of-pocket amount of $6,500, your copay goes to $0. For partial extra help, that same limit establishes when you move from paying 5%. You can pay 5% of the cost of your brand name medications if you have partial extra help.
Wow, okay. So it's regardless of if someone's eligible for partial or full extra help, it seems like the benefits are enormous and they carry on.
Yes.
They definitely do. They definitely do. I think something to mention is that the drug deductible for somebody without extra help is $440 or can be up to $445. And that 5% for somebody without extra help can be up to 25%. So extra help is a really significant savings.
For sure. Clara, take us through this next question that we received. What happens if you apply for extra help before your patient has Medicare Part D coverage?
So if you apply for somebody before they have Part D coverage, they can still be approved, but it's super important that they understand that they look for a Part D plan as soon as they're approved. One of the things that being approved for extra help does is it eliminates the fee or that they would have to pay, the penalty that they have to pay for not having Part D, because if they don't select Part D, they have to pay a penalty for each month they don't have either Part D or creditable coverage. So once they are approved, they have a open enrollment period once a quarter for the first 3 quarters of the year. And then when they're making their selections, it's really important. You can go to Medicare.gov to use the plan finder. And it's really important for a person to put in their drugs into the plan finder, put in the pharmacy that they go to, and make sure that the drugs that they're currently taking are on the formulary, and that the pharmacies that they go to, especially if they don't have a lot of choices locally, are in network with the plans that they're looking for.
That's great to know. Casey, anything to add on this question?
I would just say the bullet that says patients can get Part D coverage after extra help has been approved, that's they could actually get Part D coverage before they choose a Part D plan through something called the LINET program, or LINET, and that provides basically coverage between someone's extra help being approved and their enrollment in a Part D plan that they select. And Claire talked about how important that selection is. So a person doesn't have to wait until their Part D plan starts to access medications once they have applied for extra help, which is really important and can get someone access to their medicine faster and without as much delay.
That's terrific. LINET is such an important resource. I didn't know about it until a few years ago, and I was amazed by it because from my understanding, for the most part, the extra help application will take about 6 weeks for you to hear back about a decision, and that's crucial time. So how does LINET work, and how can people get involved or get their patients signed up for that? And where does that really fall in between actually filling out the extra help application?
So you just call a number. It's not particularly complicated. There's a phone number. There's access to the LINET program. The you can provide what's called best available evidence, so evidence that you have applied for or are approved for the Extra Help program, or you are automatically enrolled in the Extra Help program, but it hasn't gotten to your plan yet, whatever. You provide that evidence to the pharmacy, and the pharmacy can call the number and bill the prescription to LINet. And pharmacists are really a good partner in accessing this, because they're the ones who are actually going to be contacting LINet, and they are familiar with how to do it for the most part. So that's generally how I approach things, is I have people talk to their pharmacist and provide them with general information about LINet and the phone number, which we don't have here, but is readily available.
Awesome, that's terrific. Casey, you began telling us, about the relationship between Extra Help and Medicare savings programs early on.
Yeah.
Tell us a little bit more. And, there's so many programs out there. If I'm a provider, I'm strapped for time. I have so many patients to manage and things to get to. It's hard enough to be able to submit an application on my patient's behalf. How do I decide what to apply to and in what?
In what order? Yeah. So I think it's just helpful to understand on a very high level, Medicaid and the Medicare savings programs are state benefits that either work with Medicare or on their own. So for Medicaid, people obviously can have Medicaid without Medicare, but people with Medicaid or the Medicare savings programs are automatically enrolled in Extra Help. So I think if you were someone who is very strapped for time and you're working with someone who really needs access to Medicaid because they need more comprehensive assistance, their income is low enough they are likely to qualify for Medicaid. The one application that will give you the most bang for your bucks there is a Medicaid application. The Medicare savings programs work with Medicare to provide cost sharing assistance in some cases and premium assistance for Parts A and Parts B. So those programs also automatically enroll you in Extra Help, but the application for those programs can be more onerous. So it's often helpful to apply for Extra Help because the federal government will, from the Extra Help application, send some information, if you agree to it, send some information to the state Medicaid agency, which will start an application for the MSP or Medicaid, depending on the person's income level. And the state is supposed to do active outreach to the person to follow up on that transmissal of information and start a Medicaid or MSP application going for them. They'll have to submit more information, and it's important to let a person know that that's going to happen so that they don't ignore that mailing when it comes. But you can get a lot of sort of bang for your buck in applying for Extra Help, and then automatically that starts the application for the MSP. It also gives you a protected filing date. So the MSP application sort of runs from the time that you submit the Extra Help application, which is really nice because you can get some more retroactive coverage for folks in that case. The exception to that rule is where we have those folks who, and it really depends on your state, but this is where it might be worth it to learn a little bit more about your state's rules, because there are certain states that have more expansive eligibility for the Medicare savings programs. So the income levels, the federal floor for the income levels for the Medicare savings programs are below the Extra Help limits for both income and assets. But some states have raised those levels, and some states have actually eliminated the asset test for the Medicare savings programs. This means that in those states, New York is one of them, people can apply for the Medicare, people who are eligible based on income, but over assets can apply for the Medicare savings program and then be automatically qualified or automatically enrolled in Extra Help, even in a situation where if they had applied directly for extra help, they would not qualify because their assets are too high. So this is sometimes known as a backdoor to extra help, but it can be really valuable for individuals who have limited income, but perhaps assets above those low levels that qualify you for extra help directly.
That's so helpful to know. Clara, take us through that photo. You've experienced this firsthand, as a provider, as a healthcare professional. There's just not enough time in the day. How would you recommend that a provider or pharmacist get started in navigating this entire process?
Right. So yeah, as the provider, it really depends on how things are set up. I'm a financial navigator, and so my position is to help people financially, and so I was able to help people with extra help applications, Medicaid applications, but not all providers have a position like mine. So it's really important to know where your resources are. Each state has resources. The state pharmaceutical assistance programs can help people with these applications, the Medicare Rights Center. I work for TaylorMed, and we have staff that can help people apply. We help healthcare providers with staffing. And then just check with your local hospital system if you are a patient, because a lot of times if there's not somebody like a financial navigator, perhaps a social worker.
Casey, tell us more about Medicare Rights Center, and how can providers access your organization to help them with the whole process?
Sure, I think it depends on how, I think there are a couple of ways that people can use our services depending on how involved they want to get. So at the sort of most basic level, people can always refer patients to our helpline. That number is going to be included in the materials. We can help people apply for MSP and extra help across the country, and we can actually process those applications or handle them and give them directly to HRA in New York State. And New York City. If you are interested in learning more about the programs and actually engaging in some of the more sort of systematic and programmatic work that Pan has talked about, you can learn about the extra help program and other assistance programs on our website, Medicare Interactive. And if you want to get really expert in this, you can seek out our professional coursework that can help you identify and screen people for the programs, and also really become much more expert in assisting people with applications. And that's called Medicare Interactive Pro.
That's so useful to know from both of you, because there's so much to do. And so knowing that there's support out there, those resources out there that can help from a range of just getting information to actually submitting the application on your patient's behalf is amazing. What if they don't qualify? What if the person just isn't eligible for extra help? Is there anything out there today?
There sure is. So there are some charitable foundations that provide copay support, like Pan Foundation. There's others, and that's a great resource. Pharmaceutical assistance programs through the state. I think it's also important to go through a case manager, and that would be through like local SHIP, Medicare Rights Center, and then through, if your healthcare site has TaylorMed as well.
That's terrific.
And maybe Casey can talk about appealing.
Yeah, so one of the things that we touched on a little bit, and Clara talked about how important it is to choose the right Part D plan. And that's because she mentioned this, but that's because this program helps with your copays. It doesn't address a problem of high out-of-pocket costs because a prescription is not being covered at all by your plan, either because it's off formulary or because there's prior authorization requirements or other issues. And so that matters. You want to avoid that problem by choosing wisely when you choose your Part D plan or help someone choose their Part D plan, but also if you encounter that problem, extra help isn't necessarily going to solve it. The way to address that problem is actually through filing an appeal or perhaps changing plans. And extra help can help with changing plans, as Clara mentioned. It gives you that special enrollment period. But appeals might, an appeal might make more sense if the plan is otherwise working for the person. And Medicare Rights Center, our helpline, can provide people with more information about how to proceed with that, including sample letters for providers and prescribers, which include sort of what types of information about why the medication is necessary for your patient is most helpful to include.
That's so useful to know. Thank you. Learning how to apply for extra help is no easy task. You know, once you start doing it, as evidenced by Clara and Casey, it becomes like second nature. You know, the process is straightforward. You have those tricky cases, but those resources and people out there to help. At PAN, we often see patients who may be eligible for low-income subsidy, and so this last year we partnered with TaylorMed to lead a pilot and help all patients enroll in the low-income subsidy program. In doing so, we found that there was a lot of information out there that could be useful, and that's why we developed a lot of different tools on our website to help with this process. We have an eligibility checker where in 5 quick questions, you can find out whether or not your patient will be eligible. If they are eligible, you can download the application checklist, print it off, share it with your patient so they know exactly what they need to provide you, so you can fill out the application to help them or to give them the tools so that they can do it independently. And there are links available to free personalized help on your local state health insurance assistance programs. You can visit our website to learn more. The URL is on the screen, and we'll share this resource afterwards as well. While PAN assistance programs cover prescription medications for a specific diagnosis, extra help takes it a little further. Extra help will cover all prescription medications that are covered under Part D. So for someone who's dealing with one or more multiple chronic conditions, enrolling in extra help could be the key that they need to getting treatment overall. And our goal across the board is to connect patients with all the resources they need to manage their health and out-of-pocket costs confidently. While the LIS program today does help millions of Americans access their prescription medications every year, current eligibility does block many from getting the help they need. The current income levels of less than 150% of the federal poverty level require older adults who have extremely low income. So millions of Medicare beneficiaries who do live on the fringe of poverty are unable to afford their prescription medications because their assets, although maybe very modest, render them ineligible for the program. And more than that, numerous studies show that the non-LIS Medicare beneficiaries are less likely to begin costly treatments. They're going to have bigger delays when they do start treatment. They're more likely to stop their treatment. So the PAN Foundation advocates for a change. We advocate for the low-income subsidy program to be modernized to increase enrollment and provide continuity for individuals from one year to the next. Congress should modernize the extra help program to help more patients, to eliminate the cost sharing for generic drugs, and ensure all eligible people can enroll in the program. Those specific efforts that should be taken to ensure the program reaches the people who need it and that they're most essential. So to take action, I would encourage you to reach out to your congressperson or send them a letter using PAN's Advocacy Center at panfoundation.org. With that, let's dive into questions. We have already received several, so we'll go ahead and take as many questions as we can. And if we don't have time to get to your question, we'll try to follow up with you after the webinar. So let's dive into one of the most popular questions we've asked so far. And Clara, why don't you begin with this one? How can patients or providers find out if they're already enrolled in extra help?
So one of the ways is asking them how much they pay for their prescriptions. And if they're paying that $3.70, then that is a tell that they are enrolled. If the patient has their sign-ons for their Medicare.gov, they can sign in and it will tell them whether they are enrolled in extra help and what level. However, you can't look at that unless the patient is signed in. So they would have to look at that themselves.
That's great to know. Casey, anything else to add?
No, that's it.
Awesome. So why don't you take the second question then? What about patients who have a secondary insurance plan? How would they work with those secondary insurance as well as with extra help or any other programs?
So that really depends on whether their secondary insurance includes their prescription drug coverage or not. Most people do not need Part D and another insurance, and most other kinds of insurance that people have is what's called creditable coverage. So you don't need to enroll in Part D. You can enroll at a later time without a penalty if you have creditable coverage. So it's not that common for folks, even people who have Medicare as their primary insurance and some other kind of secondary insurance, it's not that common for people to have Part D in that situation, or they might not have secondary insurance that covers their prescription drugs. If their secondary insurance covers their prescription drugs and is creditable, and so they don't need Part D, then it's worth taking a look at whether that other insurance, prescription drug cost sharing, etc., is better for them, or whether it would make more sense to enroll in Part D and apply for extra help. For the most part, it does make sense to enroll in Part D, even if that means that your secondary insurance isn't going to be paying very much for your prescription drugs. It's usually not a good idea to try and drop the prescription drug portion of your secondary insurance. You usually can't do that without losing other benefits that you're likely interested in keeping. This often comes up for us on our helpline with folks who access their prescriptions through the VA. So VA prescription drug coverage is creditable, meaning you don't need to enroll in Part D. If you don't want to, you can keep your VA coverage for prescription drugs and have your Part A and Part B paid primary. It often depends quite a bit on the specific medications that the person takes and what their cost sharing is, whether or not it makes sense to switch to Part D and apply for extra help, or whether the cost sharing through the VA system is lower. It really, there's not one answer there.
Okay, that's really helpful to know. What about if a person is on Medicare because they have a disability? They don't have an secondary insurance and the income level is low. Would they be eligible?
Yeah. The extra help program is not specific to any type of eligibility for Medicare. So people who are eligible due to age, due to receiving Social Security disability, or folks who have ESRD are all eligible for the extra help program.
That's great to know. Thank you. Clara, from a healthcare provider perspective, one question that we got is that a lot of times at a doctor's office, the provider doesn't know what type of coverage the patient has or even what services they might be receiving assistance for. So how would you recommend that they tackle that?
So I think that, so they don't know like what social type services they're receiving. Yeah. I think my answer is probably the same. However, it depends on if they are trying to help them enroll or not. So if they're not going to be able to help them enroll, I think the best thing to do is send them to somebody who can help them enroll into services. It might be a good idea to help, get them over to like the Medicare Rights Center or somebody who can look into what they're already currently enrolled into.
Okay, that's really good to know. The next question is about charitable foundations. So often we've seen at PAN even that patients may apply for charitable assistance, so providers or pharmacies may apply on their behalf. And the reason why is because they need assistance right now, right? So extra help takes about 6 weeks to complete. So how would you navigate the process and recommend should we apply for LIS right away? Should we apply for charitable assistance? What is the order of operations there?
Yeah, so I'll take that one. What I usually do is I look at what my insurance optimization opportunities are first, because those are going to help the patient in the long run. And so I would apply, if the patient is eligible and doesn't yet have extra help, I would apply for that first because it's really in the long run going to help the patient the most. But then also the patient needs help now. And the foundation can still benefit, even though it's not going to need it as much, continue to benefit the patient. So then I would apply for the foundation after that. And there's also some foundations that help with insurance premiums. And so there might be the option to switch from the copay assistance to premium assistance after the copay assistance is no longer needed.
That's a great point. At PAN, if someone enrolls and receives the PAN grant, and then later they're enrolled into the extra help program, PAN does not rescind or cancel the grant. As long as the grant continues to be used, the patient can keep the grant. So even for that $3.70 copay or the $9.20 copay, anything the patient has remaining, if the patient has a PAN grant, will be able to use it. But like you're saying, in the long run, it'll help them across the board, and not only with the medications they're getting coverage from with PAN, but all of the medications, which is the most important thing to have comprehensive coverage.
Mm-hmm.
We received one final question I think we'll be able to take today. This one's a little bit more technical. Under the catastrophic phase, does the out-of-pocket cost reach $7,050? Does that mean that the patient pays all of that, or is it a combination of payment from both the patient and the plan?
Yeah, so that's a combination of both the patient and the insurance. So, which is a complicated to even know when that amount is hit, but it is it's a shared amount between the patient and the insurance coverage.
And the pharmaceutical discount the pharmaceutical company's discount in the coverage gap. So I have clients and family members who do not trust their plan's calculation of this and try and do it themselves. I have not seen a plan be wrong about this. Actually, it's pretty straightforward math from their perspective in terms of like how much you have spent, your out-of-pocket costs. It's pretty hard to keep track of from the patient's perspective. Every single Part D plan notice, like every monthly or quarterly printout that you get that says this is how much we paid for your medications, this is how many prescriptions you filled, etc., has at the bottom or like midway, it has a chart that says this is where you are, this is your total drug cost, this is your out of pocket, which are two different numbers, and this is where you are in your coverage phases. And yeah, I've not actually seen a situation where they've done that math wrong. So I wouldn't worry about that too much. I kind of just advise people to let your plan keep track of that, because they actually do a pretty good job of that.
That's terrific to know. Any final remarks, Casey and Clara? What would you recommend to providers for people who know about this process already, who have been day in and day out doing this, and also those who are new to it and looking to get started? What advice do you have?
So I'll jump in first because I had it at top of mind based on the conversation you all just had, which is the Medicare Rights Center asks the permission to ask every person who calls our helpline, no matter what they call for, if we can screen them for low-income benefits, both the Medicare Savings Program and Extra Help. And we do that in part because these programs are under-enrolled and they could help a lot more people, but also because of what the second to last question sort of implied is oftentimes people with lower incomes or who are eligible for these programs sort of scrape by and can handle their out-of-pocket costs, can handle their copays until something urgent is happening, until something catastrophic is happening, and their prescription gets way more expensive. They need something urgently, and the out-of-pocket obligations are too high, and the time is of the essence. So having these programs in place before that happens is really crucial. And so when people call us and ask, how do I choose a Part D plan, or I'm new to Medicare, what do I need to know? This is part of that conversation for us. And I would encourage you to include it as part of your conversation about the sort of financial health of your patients. And that includes, unfortunately, if folks can't pay for their medications, they're not going to take them. And then that really undermines the really important work that providers are doing. So,
Well said.
Yeah, I'll totally echo what Casey said. And and TaylorMed has some staffing available if you were to reach out and talk to them to help out a team.
That's terrific. It's so useful to know that those resources are available, and reaching out is tough. But once you start, you'll open yourself up to a whole new avenue, and those even people available like at TaylorMed, like at Medicare Rights Center, like at PAN, and all of these other wonderful places through the state to even just help you with the process of starting to reach out. That is all the time we have for today. Thank you to our wonderful panelists, Clara and Casey. We've learned so much from today's discussion, and we appreciate all of your guidance and expertise. Thank you so much to all of our participants listening in today. We hope this information was helpful, and you'll continue the conversation on how you can get your patients enrolled. Our contact information is listed on the screen. If you have any other questions, feel free to reach out to any of us, and we'll be happy to help. We will be sharing slides and a recording of this webinar to your emails over the next week. Thanks so much and have a great day.
Thank you.
Yep, thank you.